Well, good afternoon. I'm very pleased to be joined today by Prince George's County Executive Angela Alsobrooks and Dr. Mohan Santha, who's the President and CEO of the University of Maryland Medical System. As of this morning, Prince George's County has had 3,875 cases of COVID-19. And Maryland has 14,775 confirmed cases. In the past 35 days, 631 Marylanders have lost their lives to this deadly virus. 3,325 coronavirus patients have been hospitalized, and 1,432 patients are currently hospitalized, including 905 acute care patients and 527 intensive care patients. Today, we have surpassed 27,000 cases in the National Capital Region, and 1,159 people have died in Maryland, D.C., and Virginia. This deadly virus continues to spread in every single jurisdiction in the state. But the highest concentration of cases in Maryland is right here in Prince George's County. 37 days ago, I launched an unprecedented public health surge plan by enacting an executive order directing the Maryland Department of Health to open closed hospital facilities and to take other measures necessary to immediately increase our capacity by an additional 6,000 beds in order to meet the projected demand by this escalating virus. The very first suggestion I had in our first meeting discussing this topic with our team that first day was, why don't we reopen the Laurel Hospital? And here we are today at the newly launched Laurel Medical Center. This renovated and reconfigured facility will now provide an additional 135 beds, including 35 intensive care beds, to treat patients infected with COVID-19. The Laurel Medical Center is being staffed by nearly 400 contractual medical professionals and healthcare workers who will be managed by the University of Maryland Medical System. This hospital first opened in 1978, which was the year that my father was elected as the county executive of Prince George's County. Over the years, this facility helped save many lives before it was downsized and downgraded. But now, with its rebirth, it is once again going to help us save lives, not just here in Prince George's County, but throughout the National Capital Region. Making this happen so quickly, months ahead of schedule, was a huge undertaking involving many, many people. And I just want to take a moment to thank Dennis Schrader, who's the Chief Operating Officer of the Maryland Department of Health, and his entire team, Dr. Mohan Santha and all the folks at UMS and the Prince George's Hospital Center, and especially I want to thank County Executive Alsobrooks and all of the local leaders for their incredible partnership. On Friday, we will be introducing our Maryland Strong Roadmap to Recovery, a safe, effective, and gradual plan which will allow us to reopen, to rebuild, and to recover just as soon as it is safe for us to do so. This recovery plan, which has been developed over many weeks in consultation with our coronavirus response team of doctors and public health experts, has 4 essential building blocks that are needed to be solidly in place before we can be in position to begin lifting restrictions. First, expanding our testing capacity. Second, increasing hospital surge capacity. Third, increased supply of PPE. And fourth, a robust contact tracing operation. Our teams have been making significant progress in each of these criteria. On Monday, we announced a major breakthrough on the most critical part of both our recovery plan for Maryland and the reopening guidelines the President released a week ago, which is the capability of doing widespread testing. Maryland has successfully expanded our testing capability by over 5,000% over the past month. We've completed more than 76,000 tests to date. Here in Prince George's County, the Maryland National Guard, in partnership with the Maryland Department of Health, County Executive Alsobrooks, and the Prince George's County Health Department, established the state's very first coronavirus drive-through screening and testing location at FedEx Field in Landover. And we have established drive-through centers all across the state, including at our VEEP stations. Last week, we secured 40,000 additional tests. We invested $2.5 million to help the University of Maryland use cutting-edge robotics to build their capacity in order to handle the ability to handle 20,000 tests per day. And on Saturday, through the success of our Operation Enduring Friendship, we received a payload of lab-gun COVID-19 PCR test kits from a South Korean company called Lab Genomics, which will give Maryland the capability of performing 500,000 coronavirus tests. This 500,000 test capacity is equal to the total amount of testing that has been completed by 4 of the top 5 states in America added together. We had a second plane load from Korea Air land at BWI this morning with another payload. A couple of days ago, on Wednesday, actually, we had an offer from both the Vice President and the President saying that they would now agree to allow the state of Maryland to access the countless federal labs that are located in our state. Access to these federal labs can be key to utilizing the 500,000 tests that we acquired from South Korea, and we are looking forward to moving forward on this very important potential federal-state collaboration. Second building block of our roadmap to recovery is what we're focused on here today, increasing hospital surge capacity. In addition to the Laurel Medical Center here in Prince George's County, the 250-bed field hospital at the Baltimore Convention Center has been completely staffed and set up and will be admitting those patients who no longer require a hospitalization but need a location to complete their care and to fully recover. Here in Prince George's County, we have also opened the first beds at Adventist Fort Washington Medical Center. We're adding additional beds, including intensive care beds to that location, as well as to the Prince George's Hospital Center in Cheverly. We're expanding capacity with 22 surge response tents across the state, including at Doctors Community Hospital in Lanham, and at Southern Maryland Hospital Center in Clinton, at Holy Cross Hospital, and Washington Adventist Hospital in White Oak, and also along with 100 additional beds at Jessup and at Hagerstown to address the needs of corrections and detention centers. We're now on track to not only reach but actually exceed our goal of 6,000 additional beds by reaching a surge capacity of more than 6,700 new beds in the coming weeks. The third building block of our Maryland Strong Roadmap to Recovery is more access and availability of personal protective equipment, or PPE, which is a problem that has plagued not only us but states all across America and countries around the globe. We have had a multi-agency task force working literally around the clock, day and night, 7 days a week, focused on this issue. And while the problem's not solved, they have made and are continuing to make great progress with large deliveries coming to our warehouses on a daily basis, including 5.9 million surgical masks we've recently acquired, including 1 million masks from our friends in Korea, 1 million KN95 masks, including 1 million from Korea, and 705 N95 masks, 2.3 million surgical gowns, 1.1 million face shields, and an additional 1,000 additional ICU beds. The fourth and final building block of our recovery and reopening plan is a robust contact tracing operation, which will enable us to investigate every positive case as we fight our way out of this pandemic. We already have 250 contract tracers working with our state and local health departments across the state. And this morning, we authorized a contract with NORC, the National Opinion Research Center, which is the nation's oldest and largest university-based research firm, operated by the University of Chicago with corporate offices in Bethesda. Under this agreement, we will quadruple our present disease investigation capability and ramping up to be able to contact 1,000 new cases per day. We are also today launching a new state-of-the-art contact tracing platform for the COVID-19 virus called COVID Link, which will assist in monitoring and collecting information about people who test positive for COVID-19 and individuals who they have come in close contact with to determine who needs to self-isolate and any other further steps that need to be taken to ensure that the virus is not spreading further. This innovative COVID Link platform will utilize medical data from the Chesapeake Regional Information System for our patients. It's called CRISP. Maryland's 1,000 contact tracers will be trained on this new technology to make sure that all information is collected in accordance with all regulations and guidelines for the security and privacy of all medical data. I want to thank Rhode Island Governor Gina Raimondo and Mayor Stephen Adler of Austin, Texas, who consulted with us on this initiative. I just completed another call today, our 16th call with the nation's governors. And as the chairman of the NGA, I continue to encourage states and counties and municipalities to work together to share best practices in order to identify the most effective and efficient ways to combat this pandemic. Our entire team has been working hard and making incredible progress on all four of these necessary building blocks so that as our numbers start to improve and look better, we will be in a position to safely reopen our state and get people back to work. With these crucial components now firmly in place, on Friday, we will be introducing our Maryland Strong Roadmap to Recovery, which will lead us safely out of this pandemic into a brighter and more hopeful future. And finally today, I want to just take a moment to recognize the many countless small businesses that have stepped up during this crisis to adapt their operations in order to help those in need. And you may have seen when I came out here, I was wearing this Maryland Strong mask that I wore to the press conference today. It's made by Route 1 Apparel, which was started here in Prince George's County in College Park in 2010 by University of Maryland student Allie Von Paris. Last month, Allie and her company generously donated their entire inventory of fanny packs to healthcare workers on the front lines, and then they pivoted their entire operation to making face masks. And so they're available at Route 1 Apparel's website, and for every mask that anyone buys, they also then donate a mask to Maryland healthcare workers and first responders. So much like the opening of this hospital that we're here for today, it's just another kind of shining example of the very spirit of our Maryland Unites initiative. It shows how anyone, how any institution or any small business or any individual Marylander can be a part of our efforts to save lives and to defeat this hidden enemy. And it is yet another reminder that we really are all in this together. And with that, I want to turn it over to the great county executive of Prince George's County, my friend, Angela Alsobrooks, who has been a terrific partner and is doing a wonderful job leading her state in this crisis. Thank you, Angela.
Good afternoon. I first want to begin by welcoming the governor home. I'm always thrilled to do that, and so I want to say welcome home, Mr. Governor, and I'm really pleased today to be joined also by my partners. Our County Council Chair, Todd Turner, is here. Vice Chair Calvin Hawkins is here. Councilmember Tom Dernoga, I know, is here as well. Senator Jim Rosapep is here, as well as Delegate Mary Lehman. I want to thank, as well as also the mayor of Laurel. Also, want to say thank you so much for joining us today as well, Craig Moe. And so I want to thank Mr. Governor for being here, and to say how much we appreciate your leadership, how much we also appreciate all of the swift action that has been taken since our county and our state was engulfed in this crisis regarding the coronavirus. You heard the governor say it a moment ago, but we have lost here 152 souls to the coronavirus. We also have 3,868 confirmed cases of the coronavirus here in Prince George's County, the largest case count in the state. And I think it is so important to note now, I believe that the governor has led in this way. And I'm really proud to be a part of a state that understands these are not cases, these are people. These are humans, these are our family members, our friends, these are our neighbors who we are talking about. And so the urgency with which he has tackled this has really been amazing, and we are really grateful for it. You heard that the governor right away upon hearing about these cases allowed for Prince George's County to be the first place in the state that stood up a screening and testing site. As we understood that there are too many in our county and in our state who are without health insurance. And so that facility would allow us, the 50,000 plus individuals in Prince George's County who are not insured, would have the opportunity to be screened and tested and treated for this virus. And so we are really grateful that that site, which opened on March 30th, so far has screened over 800 individuals, tested 721 patients, and this site has really helped us to expand health care and expand access to some of our residents who lack health insurance and who don't have access to doctors, but who certainly need that help. I'd also like to thank the state of Maryland's health department, which has been really instrumental in helping us to facilitate that site, as well as the National Guard and the United States Army. They've been wonderful partners. And we've seen also the need for additional testing. So as of last week, we expanded the capacity of that particular testing site to be able to administer at least 200 tests per time we were there. We're there 3 times a week, so 600 tests during that week, and we know that we will be able to continue to expand the testing capability thanks to the efforts of the governor, and I also should say our First Lady, who is amazing as well. We want to thank her also for the work that she did in getting us those additional tests. Their work at FedEx will also help us in contact tracing, which is a really crucial part of our efforts to flatten the curve, not only in Prince George's, but we know that we will also flatten the curve throughout the state. And in conjunction with that, I've been able to order an executive order regarding the wearing of face masks and ensuring that all of our essential workers, as well as those who are at our grocery stores and those who are driving transit in our county, would be safe, as well as we stop the spread of germs and stop the spread of this virus that is killing and making folks ill. Now, as we approached the surge, we knew that we would also need to expand hospital capacity. Prince George's County's infrastructure is new and transitioning, and so we knew that there would be a great need to expand hospital bed space. We knew that we would also need additional ICU space. And so we want to thank the governor for the additional beds that are open here, the 135 beds. And I have to tell you something that he said I love when we talked. He said, you know, I'm native Prince Georgian, and so when I heard that we needed those beds, without a second thought, I said, open up Laurel Hospital. You know, let's get it open. And so he was already familiar with Laurel, so now we're reopening floors 3, 4, and 5. Here at the Laurel Hospital, which will lessen the stress on many of our existing medical facilities as we continue this fight. And I'm glad that the governor saw what we did, and that is that this hospital presents for all of us a really wonderful opportunity to be able to handle the surge as it occurs. We know that we are really still very much in the middle of this, and that will have great need in the coming weeks to be able to care for Prince Georgians in Prince George's County. And so to expand that bed space was really critically important to all of us. And finally, I say that as our citizens, they have many, many needs, and we are facing so many uncertainties at this time. But I am proud to say that we are a strong county, that this is a strong state, and with strong and compassionate leadership, the governor, I will, and as well as all of the other leaders who are here throughout the state, all of our collective efforts as a state and as a county will ensure that we will come through this stronger than we started. I want to thank you again for Mr. Governor for being here. I want to thank you for all the accessibility. The administration has been wonderful. I also want to thank Dr. Santha, who's been amazing for all of us, and we will get through this together. Thank you so much.
So good afternoon. My name is Mohan Santha, and I'm proud to serve as the President and CEO of the University of Maryland Medical System. Let me begin by saying, Governor, thank you. Thank you for demonstrating profound leadership as we've started into this healthcare crisis, and the way you've led us through this crisis, I think, is a phenomenal example of what it means to demonstrate leadership at the time of greatest need. County Executive Alsobrooks, you, as a partner, you have been a staunch advocate for the needs of the community of Prince George's County, and together, I think today, what we're announcing here in Laurel, I think represents the power of partnership and the power of commitment to serve the greater good. It is, in fact, as Governor described, a little over a month ago, we got the call that said that Governor would like to see us open Laurel back up. Let it become a resource given the potential needs that we would be facing across the state, and very specifically here in Prince George's County. And so he set upon us the expectation of turning on this organization in a month's time. And thanks to the passion and energy and commitment of partnership from state level to the county level to the unbelievable workforce that represents the leaders at the University of Maryland Prince George's Capital Region Medical Center system, we were able to accomplish that, and today represents a step forward in how we are addressing this healthcare crisis. As the county executive described, this allows us to expand the capacity to be able to serve the needs of citizens of the county here in the county. But we also want folks to appreciate that it also provides an incredible resource to the entire state of Maryland, because what we've realized here in the state is exactly what we've seen around the country, and that as we look at COVID-19 and its incidence and what we've experienced, is that the surge effect does not hit us all at once. And for our health system, 13 hospitals across the state of Maryland, we've been able to leverage the resources that define our health system by bringing to bear human capital, human and resources, and technology to where the need is greatest. And so while that need today is here disproportionately in Prince George's County, what we know is that as we get on the backside of the peak of the surge here in Prince George's County, we'll be able to leverage this resource for the benefit of citizens across the state of Maryland. And so thank you. On behalf of our entire organization, I also want to recognize the unbelievable leadership of the University of Maryland Capital Region Health System, Dr. Joe Wright, Dr. Trudy Hall, Min Godwin. They have put forth an unbelievable energy and effort while serving the healthcare needs of the patients and the community members who are coming to us to make sure that this effort could in fact be operationalized in the time frame that we all worked hard to accomplish. So on behalf of the health system, thank you, and we look forward to continuing to serve the needs of the county and of the state.
Thank you, With that, we'd be happy to take a few questions.
Governor,
You look? Can't tell you a whole lot about it other than I was in an important meeting earlier, but the First Lady did go out and greet the Koreans once again on the tarmac, and they just brought some additional supplies that are going to come in handy. No, it wasn't. Those masks are a different order.
Governor, some of the governors in other states are making moves to reopen Georgia, as you know. Could you explain, if you could address the camera,
Yeah, sorry.
could you explain to area residents the downward trend that the White House plan says needs to be in place and where the DMV fits into that plan currently?
So the federal guidelines that were issued last Thursday evening, I think, call for downward trends in the numbers, particularly for hospitalizations and ICU beds, and those are the things that we're looking at before you should even consider phase one of a reopening. And we are not at that point, and if you look at the Maryland, D.C., and Virginia area, we're still, although we're hopeful that we're going to start to see some numbers level off, we're currently still on an upward trajectory rather than a downward trajectory. Part of that is because of the great work that we've done, because we were early and aggressive in our efforts to, you've heard a lot about flattening the curve, and by flattening it, you also lengthen it. We didn't have the spike or the high numbers that you saw in other places, but well, I'm as anxious as anybody to get things open as quickly as we can, and I'm concerned about the people who are not working and the small businesses, but we want to do it in a safe way because we can't have an overload of our healthcare system.
Governor, are you, and perhaps Doctor, are you confident now that there are enough beds, there will be enough beds? How close to capacity? We know the numbers, we know how many beds, but that's the capacity.
Well, I am hopeful and fairly confident. The group effort between all of our hospital systems, our health department, all of our local government partners, help from FEMA and everybody else. I mean, it's been a tremendous effort. Adding 6,700 hospital beds in like 40 days is a pretty unbelievable accomplishment. And lowering that spike so we didn't have the huge numbers. Hopefully we're not going to need to use all of those, but I think we're going to be in much better shape than some of these places where you saw people stacked up in the hallways and running out of ventilators and not having ICU beds. Sure, yeah, please.
So opening this facility really helps the entire county. 135 additional beds with, I believe we have, Dr. Something, how many ICU beds? About 15? 35 ICU beds as well. So what this means is when the surge continues to occur, it means that we don't have to send our patients out to send them up to Baltimore, over to Washington, D.C. This means that we have the capacity now to have med-surg beds right here, ICU beds with ventilators right here, and it means that we can serve the entire county. And as you've heard, we can also, this is also a resource for the entire state. So it expands bed capacity not only in the county, but it also adds to the bed capacity for the state. And so this means that as the surge happens, our hospital readiness we feel pretty confident about.
Executive, you can address the camera on this. There was a teleconference that you were a part of where you had expressed some concerns that maybe some people in your own community are not seeking help quickly enough. Could you address that and anything you want to tell people about what they should be doing?
So thank you. First of all, I want to thank Dr. Ernest Carter and our health department. They have done a heroic job of responding to this virus. But one of the concerns we have is as the numbers start coming in and we collect data, we realize that men in particular have really succumbed to this virus in terms of the deaths that we've seen. So for example, we know that among African American men, they account for about 64% of all of our deaths. We know that for white men in our county, they account for about 80% of the deaths in that population, as well as Hispanic men who account for over 60% of the deaths in that population. And so we're very concerned that men have been waiting. Dr. Carter tells me that we ought to really send home the message that if you're having symptoms, do not wait, because we were so distressed to learn that at least a couple of our residents died at home last week. because they waited too late to seek medical treatment. So we want to send the message that if you have those symptoms, do not wait. Today we also announced that you can now text 911. If you're unable to speak, you can now text 911 and we will get to you and get you the help that you need. But we don't want people waiting, and we're very concerned that we're seeing that some of our men are waiting too late and are at home.
Right, so what we described this morning was the early experience within our medical system. And the reason we described it as early is because we recognize where we are in the peak relative to data that's come from other parts of the country with more mature experience. And so the point of what we were describing today is that while we see differences in rates of infection based on race, right now we are not seeing differences based on in mortality and in-hospital stay, but we know that's very early data compared to what you're seeing from around the country. So we would not want anybody to misunderstand that data. So I think health systems from around the state are partnering in the way we've done it to this point with state officials, with county officials, with local health departments to ensure that we continue to maintain a focus on the needed resources based on the incidence of the disease that we're able to understand now in our communities better than we were a few weeks ago. As we expand our testing capacity outside the walls of the hospital, that will also allow health systems to better prepare the needed resources for what we have coming as we get on the backside of this peak.
Yeah, that's a great question that I don't really know the answer to, and I'm not sure we have any experts here that can answer the exact percentage of what we need. But there's been a terrible shortage of PPE in hospitals and systems and in states across the country. The federal stockpiles were depleted, and that's improving everywhere. We're getting more assistance from FEMA, and we're getting more companies ramping up production. We're buying things all over the world, so we have things from China, from Korea, from companies everywhere, but it's still not quite enough, and hospitals are still stretched with the stuff that they need. They're able to operate right now, but if we have a peak, we're pouring stuff in literally every day and every night, and it's going out the door as fast as it's coming in. So we're just, I would say, keeping up with a almost adequate supply, but it's like digging in the sand. It goes in and out, and we need more. And the president's finally utilizing the Defense Production Act to start producing swabs, which is good because there was only one company apparently in the world doing it. It was in Italy, and Italy, you know what happened there, so they weren't doing it. We've had a lack of supply of things like masks, which doesn't seem that complicated, N95 masks, but they don't have them anywhere in the country. So, but it's getting much better. I don't have a percentage of where we are. We're feeling much more comfortable than we were. We've made huge improvements, but I would say we have a long way to go.
Last question, please.
Yeah, let's just say that on a couple of days ago, when we announced that we had brought in 500,000 tests from Korea, and we're the only state in America that has 500,000 tests, and that was more than the top 4 of the 5 states in America have done in the past month and a half. My phone was lighting up from every governor in America saying, how do we get some of those tests? I'm not sure what the answer to that question is, because I think we're the only state that Korea had made an agreement with, but we're going to try to help all of everybody get here in the state of Maryland, first of all, but if we can help our neighbors and our other governors, find a way to help their states, we're going to do that too.
Thank you.
Thank you all very much.
Thank you.